Good afternoon, the Vice Chancellor, Deputy Vice Chancellors, Principal Officers of the University, Provost College of Medical Sciences, Deans of Faculties, parents, colleagues, medical students, friends and well-wishers present. November 2015 will forever remain nostalgic in our hearts. When we received the good news of being admitted to study medicine, a 6-year program at the prestigious University of Calabar, little did we know that 6 years would turn into 6 plus X years, where X was the Nigerian factor and the coronavirus pandemic. For us, first year was like being dropped in a rat race. It was the best of times and the worst of times, the age of foolishness and of wisdom. As neophytes, we trudged through the waters of the physical sciences, from the gas laws of chemistry to the Newton laws of physics, and learned the proper use of English and philosophy, hence different schools of thought. If I remember vividly, I was an existentialist, and my favorite quote was that of Friedrich Nietzsche, which says, "To live is to suffer, and to survive is to find meaning in the suffering." To find meaning in suffering is what we found, and that is why we are seated here today. As we moved into preclinicals, we were thrown into the abyss of basic medical sciences, anatomy, physiology, and biochemistry. The experience was like learning a new language. We heard many tales of the great gross anatomy that sent chills down our spine. Tales of cadavers waking up to chase students out of the gross lab, or of the viva voce where we'll be asked to list all the muscles in the body, their origins and insertion. Luckily for us, none of these tales ever happened. The ever-knowing lecturers in the Faculty of Basic Medical Sciences, you lay the foundation on which we stand today. The clinical class came so swiftly, like the dawn of a new day. As greenhorns, it was a mixture of humor and hard work. I remember our first week in internal medicine posting. One of us was asked to give a diagnosis after giving a history, and he quickly responded, "Neuronal challenge." Another was asked the presenting complaint of a patient, and he insidiously responded, "The patient presented with a chest x-ray of 3 days duration." But at the end, here we are today, fully transmogrified into doctors of international repute. I can proudly hear the university community saying, "These are our doctors in whom we are well pleased." Pharmacology wowed us with the names of drugs, their indications, contraindications, and side effects. We quickly understood that nausea and vomiting were the beloved side effects of most drugs, if not all. The Department of Laboratory Medicine, filled with men and women of immense learning, didn't hesitate to inculcate knowledge of tropical and metabolic diseases in us. We became familiar with trusting our instincts and wholesomely welcomed the notion that even when your eyes fail you, the outer surface of pathology pots will always appear grayish white. Then came pediatrics and obstetrics and gynecology. In obstetrics, we became awestruck when we saw firsthand the miracle of childbirth. This made us respect our mothers and even appreciate them more. Pediatrics, a department of no-nonsense doctors, drilled us in the art of medicine, processing and refining us, bringing out the best in us when it comes to child health. Whenever we heard the words, "Fair enough," the certainty of passing was as sure as the sun rising in the east. Or when we heard, "We would meet at Philippi," goose pimples immediately colonized our already stretched skin. To whom much is given, much is expected. And final year came with a lot of expectations. Being the most senior class in medical school, we're expected to lead by example, both in character and stuff level. Community medicine, laden with lecturers having the finest minds in the world, with so much vigor and steeze, taught us the science of preventing disease, prolonging life, and promoting health. Family medicine drew us close to the structure and function of the family, as well as holistic patient management. Surgeons, most often described as cocky, although they are not, did not only teach us the surgical basis of disease, but also its philosophies. We would never forget the characteristics of a black man. Our beloved internist, you kept us on our toes, challenging our intellect with so many differential diagnoses. Thankfully, we were never part of those differentials. While chronicling our story as a class, we must not forget to mention our fallen heroes who contributed in enormous ways to who we are today. Our teachers, Professor Theresa Ekanem of the Department of Anatomy, Professor Odosen from the Department of Biochemistry, Professor Bolaring, Department of Chemical Pathology, Professor Thomas Agan, Department of Obstetrics and Gynecology, and Professor O. Obasi, Department of Surgery. May their souls rest in peace. We will forever remain disciples of your academic doctrine. To our proud parents and sponsors who made sure we never lacked and provided for textbooks, even those that never existed, you occupy the highest appreciation in our hearts after God. To our friends and our junior colleagues, we are gone for good. Don't cry. One of the secrets to success, I can tell you freely, is consistency. To our dear, amiable Vice Chancellor, I make a solemn promise today on behalf of the class. Anywhere in the world and you need any form of medical attention, do not hesitate to call these doctors. We will be here for you and for your generations yet unborn. To other principal officers of the university who will not only be living here as principal officers, but as Mama Doctor and Papa Doctor, thank you. Mention must also be made of the non-academic staff, the school cleaners and security. Thank you for your sacrifice and service. To our highly respected class officials who were essential to the realization of today, George Abasiponke, Asuko Martina Raymond, Ekemini Stephen Umorin, and every other person who took the mantle of leadership at different moments, thank you. But is this truly the end? Hardly. Our journey does not end here. I encourage us all to remain lifelong learners, to forgive those who have hurt us, to allow the things which unite us be more than those which separate us, and to remain family. Let us not forget our friends in this struggle, especially those who could not be here today. We are still together regardless. As we step out into the world as graduates of this esteemed institution, whether we decide to stay back in Nigeria or we are already manifesting the Japa syndrome, let us be safe doctors, honoring the trust placed in us by our patients and communities, and upholding the highest standard of professionalism, integrity, and excellence. Congratulations, class of 2022. The road ahead may be long and challenging, but I do not doubt that we are more than prepared to face whatever lies ahead. Hold your head high and be dogged in your ambition. In the words of the great African philosopher, no grief for anybody. Always remember to maintain your steeze and composure, just like the community medicine physicians. My dearest newly minted doctors from the University of Calabar, au revoir. Although I may never see most of you again, you would have a special place in my heart. Long live the University of Calabar Teaching Hospital. Long live the University of Calabar. Long live Cross River State. Long live the Federal Republic of Nigeria. My name is Eigbire-Molen Oseremen, valedictorian of class of 2022, and it is with an avalanche of emotions that I end this speech. Thank you.